Hello, my name is Melody Austin, and I'm one of the board-certified Wound-Ostomy-Continence care nurses here at Advanced Home Care. Today I'm going to be talking to you a little about the troubleshooting of alarms on your negative pressure machine, the changing of the canisters, and the changing of your dressing. Now that you're ready to change the canister on your negative pressure wound therapy device, you'll need to do a couple of things. First off, if your machine has locked out, which you'll be indicated with a blue light, you'll need to press and hold the button until the blue light turns off. Once the blue light is off, you'll need to turn the machine off by pressing the button that is furthest to the right. Your machine is now turned off. You can safely change your canister by reaching to the side on each side the orange clips and releasing each one, and then you'll actually just remove the canister. This canister can be disposed of in your regular trash. You'll disconnect the canister from the tubing to the dressing by pressing the orange clips on each side and pulling the two pieces apart. Once you've disconnected the canister, you're safe to throw this into your regular trash can. You'll find a new canister packaged in your supplies, and you'll want to replace the canister on your machine by first of all connecting the tubing from your dressing to the canister. You should hear a click. Then you'll want to attach the canister to the bottom of the machine by simply pressing up on the machine with the canister and clamping the two orange clamps. Then you'll want to turn the machine back on by simply pressing the button that's furthest to the right. To change the canister on your Vista negative pressure wound therapy machine, you'll need to turn the machine off first by pushing the button in the middle with the straight line through it. Then you'll actually disconnect the tubing from your dressing by pressing the orange clips on each side and pulling the tubing apart. Now you'll need to remove your canister by unscrewing the bacteriostatic filter here from the side of the machine, taking the machine and tubing and disposing of it in your regular trash. Now you're ready to replace your canister. You'll obtain those from your medical supplies, place it in the canister holder, attach the bacteriostatic filter to the side of the machine, making sure there are no visible grooves in the tubing. Once you've attached the bacteriostatic filter, you're ready to attach the tubing from the canister to your dressing. And you'll actually just put these two together with an audible click. Now you're ready to turn your machine back on by pressing the center button. If your negative pressure machine should alarm low vacuum, you'll need to try to reseal your dressing. However, first you may want to check all of your connections to make sure they are secure. Here at the dressing and canister connection, and here at your dressing. If you are not able to determine that there are any leaks in your tubing, your home health nurse should have advised you on how to patch your dressing. You can silence the alarm on your machine by pressing the button with the alarm with an X through it. This will give you time to work on your dressing. You'll want to cut a small piece of the adhesive drape from your medical supplies and determine on your dressing where you may have a leak. By removing the backing from the adhesive drape, you will then place a patch over your dressing. Once you've repatched your dressing, then you'll want to restart your negative pressure wound therapy machine by pressing the button to the furthest to the right. If you're unable to seal your dressing, then you'll need to replace this dressing with a normal saline moistened dressing. Your home health nurse will instruct you how to do this procedure, as well as I will demonstrate that procedure now. The first thing you'll need to do is turn your machine off by pressing the button furthest to the right. Now that you have your machine turned off, you'll want to disconnect your dressing from the canister tubing. You'll do so by pressing the two orange buttons at the connection point and pulling them apart. Before you remove your dressing, you'll want to wash your hands either with an antibacterial scrub or with soap and water. Your home health nurse should provide you with some type of glove, either a box of gloves or gloves in a pack, and you'll want to place gloves on your hands before changing the dressing. Now you're ready to remove the dressing. You're simply going to lift the transparent drape from the wound edges. You may need to use an alcohol prep or some type of moistened gauze to assist you with this process. You'll take the dressing off completely, removing all pieces of the black foam and discarding that in your regular trash. At this point, you'll want to remove your dirty gloves, wash your hands again, and replace it with a clean pair of gloves. At this point, you'll want to gather the supplies that you need. You'll need at least several packs of gauze and a gauze pad topper. You'll need some normal saline and some tape. First of all, you'll want to open the gauze pad and moisten it with saline. Once you've moistened the dressing with saline, you will then place this dressing inside of the wound. You want to make sure that you completely open the gauze pads in order to provide a fluffed gauze packing. Now you're ready to place your moistened saline gauze into the wound bed, filling it completely. You'll then be able to cover the moistened saline gauze with dry gauze or a gauze pad topper and contact your home health nurse in order to have your negative pressure dressing replaced the next day. Once your dressing is intact, you'll want to wash your hands thoroughly. Should your negative pressure machine read high vacuum alarm, you'll need to check all of the connection points to make sure that everything is unclamped. Once you resolve your high vacuum alarm, you'll want to push the go button, the furthest button to the right, to restart your machine. Should your machine read low battery, you'll notice that it will read low battery on the screen, and you'll notice an amber light in the battery symbol. You'll need to plug your machine up to the battery pack that's provided with your equipment here in the side of the machine and into your wall outlet. Thank you for taking the time to watch this video tutorial, and thank you for choosing Advanced Home Care.
Advanced Home Care. Home care is our business. Caring is our specialty. Advanced Home Care. Home care is our business. Caring is our specialty. When your care is advanced, your recovery's enhanced. Advanced Home Care. Home care is our business. Caring is our specialty.